Hi there, my name is Dr. Monique Ruberu and I am a NAPR technology trained OBGYN physician. Oftentimes I have people asking me, hey Dr. Ruberu, what do you think about IVF? So I just wanted to share this with you guys. I am not a fan of IVF, and the reason is this: there are way too many moral implications to the use of IVF. You think about how IVF is done. First of all, they'll hand a man some pornography to go and create a semen sample. Then they'll clean that semen and they'll put it aside. Then they will shoot the woman up with medications to try and improve or increase the number of eggs that are produced in that particular cycle. When they hyperstimulate her like this, sometimes that can lead to medical problems, but then they'll go in and they'll retrieve these eggs and they'll put all of the viable eggs with the viable sperm. Next, these sperm and these eggs will come together and hopefully they will create embryos. So when they have the embryos, the next step is to grade the embryos. They'll look at them to see which ones are better quality than others, and they'll possibly discard some of the embryos. So if you believe that life begins at conception, like I do and every other embryology textbook agrees, then you'll understand that by discarding those embryos, you would be losing children. These are children that are created by the husband's sperm and the wife's eggs. So next, they will have, say, 6 embryos. So with these embryos, they can't place all of them in the mom's uterus at that time. So what they would do is they would talk about freezing about 4 of those embryos, and the remaining 2 they would place in a fresh cycle. So they'll place these embryos in the mom's uterus, and several different things can happen. Either one of them will survive or 2 of them will survive, but sometimes these babies do really well and they will split into triplets or into quadruplets. And if that was to happen, the next question is, do you mind if we reduce? Reduce means to abort those children. And so this mom and this dad, who have wanted nothing but a healthy child, are now faced with the idea of having to end the lives of some of their children in order to help others survive. And that is such a difficult place to be in. Who would want to choose that? Oftentimes, just out of sheer frustration or fear, they will choose to reduce and end up with a singleton or a twin pregnancy. And they're told that if they don't do this, their risks for preterm delivery, for abnormalities in the children will skyrocket. So then after this mother has carried these children to term, she is still left with these 4 embryos in the freezer. So she's kind of committed to go back and redo this cycle over and over and go through the same problems over and over. So what is the solution? The solution in my mind is don't choose IVF. If you look at NAPR technology, we have a lot of different options which are a lot less expensive than IVF as well. Every IVF cycle is thousands and thousands of dollars that you have to pour in order to be able to access this type of care. With NAPR technology, the most expensive medication that you'd ever use is probably around $100 for the month. All of your medical treatments can usually be covered by insurance because we're addressing actual issues that you would suffer with GYN, such as polycystic ovarian syndrome, abnormal bleeding, irregular cycles. All of those things are typically covered by insurance, whereas infertility in and of itself is not. So NAPR technology is a much less expensive, much more ethical way of managing fertility issues, where you would never be asked to harm yourself or your children, and you would be able to save some money along the way that you could use to take care of your family in the future. In addition, children that come from IVF procedures do have an increased risk of cancer, so you would be avoiding those risks as well. Typically, IVF pregnancies, you have a lot more risk of having a twin pregnancy or a multiple pregnancy, versus with NAPR technology, you'll always have singleton pregnancies, very rarely a twin pregnancy. All of these things make NAPR technology a much safer alternative, much less expensive alternative, and a much more natural, holistic, and just life-saving alternative. So we ask you to consider that. Consider coming to see us at Natural Women's Health. Our website is naturalwomenshealth.com. We'd love for you to peruse it and then come and visit us at some time. Take care. God bless you.